If your doctor has recommended a knee replacement to treat your condition, you may have several questions. To better understand this process, it's important to know what to expect before, during, and after.
Knee replacement surgery is removing a damaged joint and putting in a new one. A new joint is called a prosthesis.
Regardless of your age, degenerative joint disease may keep you from participating in activities you enjoy. Your doctor may recommend replacement surgery when pain prevents you from sleeping or doing normal activities. You cannot move around by yourself and have to use a cane or walker. Your pain has not improved with other treatment. The pain you experience can be severe, causing you to avoid using your joint, which leads to weakening of the muscle around the joint, making it more difficult to move over time. You understand the surgery and recovery involved. The day before surgery, follow the shower guidelines that will be provided to you by the pre-op nurse. They will ask you to use antibacterial soap. Please do not shave near or around the surgical site. Do not eat or drink anything after midnight, the day before your surgery. On the day of your surgery, please check with your physician about taking your blood pressure medications as scheduled prior to surgery. Leave your money, credit cards, jewelry, and any other valuable at home if possible. If you wear contacts, please bring your glasses with you. Ladies, no makeup, no nail polish, and no hair clips. Do not put lotion or powder. Go to the main entrance of Day Surgery at Renaissance, located on Dove Avenue and Leonardo da Vinci Street. On arrival, turn to your designated parking area. Bring loose-fitting clothes and comfortable shoes, and arrive to the hospital 1 hour prior to your scheduled time. After the procedure, you will be transferred to the recovery room and then transferred to the rooms at the Orthopedics Institute at Renaissance. You might experience nausea upon awakening due to the effects of anesthesia. Please notify your nurse so they can provide you with the appropriate medications to help alleviate your symptoms. After any operation, you'll have some side effects. There is usually some pain with surgery. Do not twist or pivot your body when you're using a walker. Do not climb up on a ladder or step stool. Do not kneel down to pick up anything. And when lying in bed, keep a pillow under your heel or ankle, not your knee. It is important to keep your knee straight. Try to stay in position and do not bend your knee. Your doctor, nurse, or physical therapist will tell you when you can start putting weight on your leg and how much weight is okay. When you can start bearing weight will depend on what kind of knee joint you have. It is important not to start bearing weight until your doctor tells you it is safe to do so. Ice your knee 30 minutes before and 30 minutes after activity or exercise. Ice will decrease swelling. By the time you go home, you should be able to walk with a walker or crutches without needing much help. You may need to use these walking aids for up to 3 months. You should also be able to dress yourself with only a little help and get in and out of your bed or a chair by yourself. Over time, you should be able to return to your former level of activity. Keep the dressing on your incision clean and dry. Change the dressing only if your surgeon told you to do so. If you do change it, follow these steps. Wash your hands well with soap and water. Remove the dressing carefully. Do not pull hard. If you need to, soak some of the dressing with sterile water to help loosen it. And wipe one end of the incision to the other. Do not wipe back and forth over the same area. Dry the incision the same way with clean dry gauze. Wipe or pat in just one direction. Check your wound for signs of infection. These include severe swelling, redness, and drainage that has a bad odor. Apply a new dressing the way your doctor or nurse showed you. Stitches or staples will be removed about 10 to 14 days after surgery. You may shower 3 to 4 days after surgery as long as your surgeon says you can. When you can shower, let the water run over the incision, but do not scrub the incision or let the water beat down on it. Do not soak in a bathtub, hot tub, or swimming pool. You may have bruising around the wound. This is normal and it will go away on its own. The skin around your incision may be a little red. This is normal too. You will need to avoid some sports, such as soccer or football, but you should be able to do low-impact activities such as gardening, swimming, or golf. A physical therapist may visit you at home to make sure your home is set up safely for you as you recover.
Please call your doctor or nurse if your pain does not go away after you take your pain medicine. If you have swelling or pain in your calf muscle, temperature higher than 101, redness, swelling, or drainage from your incision, please call your doctor or nurse. Chest pain, chest congestion, or breathing problems are also reasons to call your doctor or nurse.
Doctors Hospital Renaissance hopes this information was beneficial for you to have a prompt recovery. For more information, please call 362-2015.
DHR Health Network.